Hello, gentlemen. If you're over 55 and you've been waking up 3, 4, maybe 5 times a night to pee, and you feel like your stream isn't what it used to be, there are 8 warning signs your body might be screaming at you right now that prostate cancer is quietly growing inside you. And here's the scary part. Most men ignore these signs for months, even years, thinking it's just getting older. But by the time they finally see a doctor, the cancer has already spread. I don't want that to be your story. My name is Dr. Sarah Hewitt, and I've spent over 2 decades helping men just like you understand what's really happening inside their bodies. Welcome to the Beyond the Pill channel, where we cut through the noise and give you the truth that actually saves lives. Today, I'm going to walk you through the 8 early warning signs of prostate cancer that you absolutely cannot afford to ignore. We're going to talk about urinary changes, sexual symptoms, pain patterns, and those systemic red flags that show up when your body is losing the fight. And at the end, I'll give you a simple checklist you can save and use to monitor yourself starting today. Here's what recent studies show us. Men who catch prostate cancer in its early stages have a survival rate above 95%. But when it's detected late, after it's spread to the bones or other organs, that number drops dramatically. The difference between life and death often comes down to one thing: paying attention to your body's warnings. Early detection isn't just about living longer, it's about living better, keeping your independence, your dignity, and your quality of life intact. Now, before we dive into sign number 1, I want to hear from you. Drop a comment below and tell me your first name, your age, and what city you're watching from. And if this information helps you today, please hit that subscribe button and share this video with a friend, a brother, a father, or anyone who needs to hear this message. Lives are saved when we share knowledge. All right, let's get into it. Starting with warning sign number 1. Let's talk about the 2 signs that show up first for most men, and honestly, the ones that get brushed off the most. Trouble urinating and needing to go all the time, especially at night. Now, I know what you're thinking. Doc, I'm in my 60s. Of course I pee more at night. That's just life, right? Wrong. It's not just life. It's your prostate telling you something is wrong and you need to listen. Here's what's happening inside your body. Your prostate sits right below your bladder, wrapped around the tube that carries urine out of your body, the urethra. When your prostate starts to grow, whether it's from benign enlargement or something more sinister like cancer, it squeezes that tube. Imagine trying to water your garden with a hose that someone's stepping on. The water comes out weak, slow, and frustrating. That's exactly what's happening when you stand at the toilet and nothing comes out, or it takes forever to get started, or the stream is so weak you could barely put out a candle. And here's the kicker. Prostate cancer doesn't always cause pain at first. It just quietly grows, pressing on your urethra, making it harder and harder for you to do something as basic as emptying your bladder. Now, let's talk about frequency. If you're getting up 2, 3, 4, or more times a night to pee, that's called nocturia, and it's not normal. Sure, drinking a big glass of water before bed will send you to the bathroom once, but if you're going multiple times every single night and you feel like your bladder is never truly empty, that's a red flag. Your prostate is either enlarged or inflamed, and it's messing with your bladder's ability to hold and release urine properly. And here's what most men don't realize. The constant urge to pee isn't just annoying, it's exhausting. It destroys your sleep, wrecks your energy, and over time it affects your heart, your mood, your relationships, everything. So, how do you know if it's just benign prostatic hyperplasia, BPH, which is non-cancerous enlargement, or if it's actually cancer? Here's the truth. You can't know for sure without getting tested, but there are clues. If your symptoms came on suddenly, if they're getting worse fast, if you're also noticing blood in your urine or pain when you pee, those are signs that scream, "Get to a doctor now." BPH usually develops slowly over years. Cancer can be sneaky and slow too, but it can also be aggressive. The only way to know is through a PSA blood test and a digital rectal exam. I know. Nobody likes that exam. But would you rather have 5 seconds of discomfort or 5 years of regret because you waited too long? Let me tell you about a patient I'll call Tom. He was 68, retired, living his best life. He started waking up at night to pee, maybe 3 times a night. He figured it was just age. Then it became 4 times. Then 5. His wife noticed he was exhausted all the time, irritable, not himself. Finally, she dragged him to my office. His PSA was elevated. We did a biopsy, stage 2 prostate cancer. Thankfully, we caught it early enough to treat it successfully. But Tom told me later, "Doc, I wasted 6 months ignoring the signs because I didn't want to seem like a complainer." Gentlemen, your life is not a complaint. Your symptoms are not a burden. They're information. Use them. Now we're moving into territory that should make every man sit up and pay attention. Blood where it shouldn't be, and pain that won't go away. If you see blood in your urine or in your semen, I don't care how busy you are. I don't care how scared you are of doctors. You need to get checked immediately. This is not something you wait on. This is not something you Google and hope it goes away. Blood is your body waving a giant red flag, literally, saying something is seriously wrong in here. Let's start with blood in the urine, what doctors call hematuria. Sometimes it's obvious. Your urine looks pink, red, or even brown like tea. Other times it's microscopic. You can't see it with your naked eye, but it shows up on a urine test. Either way, it matters. Now, not all blood in the urine means cancer. You could have a urinary tract infection, kidney stones, or an enlarged prostate that's causing some bleeding. But here's the thing. You don't get to decide which one it is. Only proper testing can tell you. And if it is prostate cancer, blood in the urine often means the tumor has grown enough to affect the surrounding tissues or blood vessels. That's not early stage anymore. That's your body telling you the clock is ticking. Blood in the semen, hematospermia, is even more alarming to most men because it's so unexpected. You're having sex or you're alone, and suddenly there's blood. It's terrifying. And it should be. While it can be caused by infections or inflammation, it can also be a sign that prostate cancer is affecting the seminal vesicles or the prostate gland itself. The blood vessels in that area are delicate, and when a tumor grows, it can rupture them. I've had patients tell me they saw blood once, freaked out, then it didn't happen again. So they convinced themselves it was nothing. Gentlemen, one time is enough. One time is your warning shot. Don't wait for it to happen again. Now let's talk about pain and discomfort in the pelvic region. This isn't your typical muscle ache from working in the yard or sitting too long. This is a deep, persistent discomfort in your lower abdomen, your perineum. That's the area between your scrotum and your anus, your rectum, or deep in your pelvis. It might feel like pressure, like something is sitting heavy inside you. It might be a dull ache that never quite goes away. Or it could be sharp pain when you sit down, when you urinate, or when you ejaculate. This kind of pain happens because the prostate is inflamed, infected, or being invaded by cancer cells. And when cancer spreads beyond the prostate capsule, it can press on nerves, muscles, and other organs, causing pain that radiates to your lower back, your hips, or down your legs. Here's what scares me as a doctor. Men are conditioned to tough it out. You've been told your whole life to push through pain, to not complain, to be strong. But there's a difference between being strong and being foolish. Ignoring pain doesn't make you tough. It makes you vulnerable. Pain is your body's alarm system. When it goes off, you don't smash the alarm and go back to sleep. You find out what's burning. If you're experiencing pelvic pain along with urinary symptoms, blood, or sexual changes, you need a full workup. That means PSA test, digital rectal exam, possibly an MRI or a biopsy. These tests aren't fun, but they're life-saving. And the sooner you do them, the better your chances of catching cancer while it's still treatable. I remember a man named Richard, 72 years old, who came to me complaining of a dull ache in his pelvis that had been there for months. He thought it was arthritis. He'd been taking ibuprofen every day just to get through. When I examined him, his prostate was rock hard and irregular. His PSA was through the roof. The biopsy confirmed aggressive prostate cancer that had already started spreading to his pelvic bones. Richard looked at me and said, "I thought I was just getting old. Gentlemen, pain is not a normal part of aging. Discomfort is not something you just live with. Your body is trying to save your life. Let it." Let's talk about something most men would rather avoid. What happens when things stop working in the bedroom? Erectile dysfunction and ejaculation problems. Now, I know this is a sensitive topic. Nobody wants to admit they're struggling with this. But here's the reality. Your sexual health is directly connected to your prostate health, and ignoring problems down there could cost you your life. Erectile dysfunction, ED, is incredibly common as men age. By the time you hit 60 or 70, a lot of factors can contribute to it. Poor circulation, diabetes, high blood pressure, stress, low testosterone. But here's what you need to understand. Sudden or rapidly worsening ED, especially if you've never had problems before, can be an early warning sign of prostate cancer. Why? Because the nerves and blood vessels that control erections run right alongside your prostate. When a tumor grows, it can compress or damage those nerves. It can also affect blood flow to the penis. So if you used to wake up with morning erections and now you don't, if you used to have no problem getting hard and now it's a struggle, if your erections are weaker or don't last as long, that's not just getting older. That could be your prostate sending you a message. Here's the part that frustrates me as a doctor. So many men go straight to Viagra or Cialis without ever asking why they need it in the first place. Don't get me wrong, those medications can be helpful, but they're treating the symptom, not the cause. If your ED is caused by prostate cancer, popping a pill isn't going to stop the cancer from growing. It's just masking the problem. You need to find out what's causing the dysfunction. Get your prostate checked. Get your PSA tested. Rule out cancer before you assume it's just age or stress or bad luck. Now let's talk about ejaculation problems, because this is another sign men ignore or feel too embarrassed to mention. Painful ejaculation is not normal. If it hurts when you climax, if there's a burning or stinging sensation, if you feel pain in your pelvis or lower back during or after sex, that's a red flag. Prostate cancer, or even prostatitis, which is inflammation of the prostate, can cause this kind of pain. The prostate produces most of the fluid in your semen, so when it's inflamed or invaded by cancer, ejaculation becomes painful. Some men also notice a decrease in the amount of semen they produce, or they have what's called retrograde ejaculation, where the semen goes backward into the bladder instead of out through the penis. These changes happen because the prostate and the surrounding structures aren't functioning properly anymore. Here's the thing that breaks my heart. Men will suffer in silence for years because they're ashamed. They stop being intimate with their partners. They avoid sex altogether. They feel like less of a man. But gentlemen, your worth is not defined by your erections. Your masculinity is not measured by your sexual performance. What defines you is how you take care of yourself, how you face challenges, how you protect your health so you can be there for the people you love. If you're experiencing ED or painful ejaculation, that's not a failure. That's information. And information is power. I had a patient, let's call him David, who was 66 and had been married for 40 years. He started having trouble maintaining erections about a year before he came to see me. He didn't tell his wife. He didn't tell anyone. He just quietly withdrew, made excuses, avoided intimacy. His wife thought he didn't love her anymore. Their marriage was falling apart. When he finally came to my office, it was because his wife begged him to get help. His PSA was elevated. We found prostate cancer. Thankfully, it was still localized and we treated it successfully. But David told me later with tears in his eyes, "I almost lost my marriage and my life because I was too proud to ask for help." Don't be David. Don't wait until everything is falling apart. If your body is changing, if sex isn't what it used to be, get checked. It could save your life and your relationship. Now we're getting into the signs that tell you cancer isn't just sitting quietly in your prostate anymore. It's spreading. It's metastasizing. And when prostate cancer spreads, it has a favorite destination: your bones. Specifically, your spine, your hips, your pelvis, your ribs, your thighs. If you're experiencing deep, persistent bone pain in any of these areas, pain that doesn't go away with rest, pain that wakes you up at night, pain that gets worse over time, you need to get to a doctor immediately. This is not arthritis. This is not a pulled muscle. This could be cancer eating away at your bones. Here's how it works. Prostate cancer cells love bone tissue. When they break free from the prostate and enter your bloodstream, they travel to your bones and start growing there. They disrupt the normal bone remodeling process, weakening the bone structure and causing pain, fractures, and even spinal cord compression if it's in your back. The pain is usually deep and aching, sometimes described as a gnawing sensation. It might start in your lower back and radiate down your legs. It might feel like your hips are constantly sore, like you've been hit by a truck. And here's the cruel part. By the time bone pain shows up, the cancer is already advanced. It's stage 4. That doesn't mean it's untreatable, but it does mean your options are more limited and the fight is harder. I want you to understand something important. Bone metastasis is serious, but it's not an automatic death sentence. With modern treatments, hormone therapy, chemotherapy, radiation, and newer targeted therapies, many men live for years, even decades, with metastatic prostate cancer. But the key is catching it before it gets to that point. That's why all these earlier signs matter so much. The urinary symptoms, the blood, the sexual changes, those are your early warnings. Bone pain is your body screaming that time is running out. Now let's talk about the other systemic signs: unexplained weight loss and crushing fatigue. If you're losing weight without trying, if the pounds are just falling off and you're not dieting or exercising more, that's a major red flag for cancer. Your body is using all its energy to fight the disease, and it's burning through your fat and muscle reserves. Cancer cells are metabolically hungry. They steal nutrients from your healthy cells. You might also lose your appetite. Food might not taste the same, or you might feel full after just a few bites. This kind of weight loss is different from normal aging or lifestyle changes. It's rapid, it's noticeable, and it's alarming. And then there's the fatigue. Not the "I had a long day" kind of tired. I'm talking about the bone-deep exhaustion that doesn't go away no matter how much you sleep. You wake up tired. You can't make it through the day without napping. Simple tasks feel like climbing a mountain. You used to mow the lawn, play with your grandkids, go for walks, and now you can barely get off the couch. This kind of fatigue happens because your body is in a constant state of inflammation and stress trying to fight the cancer. Your immune system is working overtime. Your red blood cell count might be dropping, causing anemia. Your hormones are out of balance. Everything inside you is struggling, and it shows up as this overwhelming, unshakable tiredness. Here's what terrifies me. Men will ignore these symptoms for months, even years, because they chalk it up to just getting old. They'll say, "Well, I'm 70. Of course I'm tired. Of course my back hurts. Of course I'm losing weight. I'm not as hungry as I used to be." But gentlemen, aging doesn't mean falling apart. Aging doesn't mean suffering in silence. If your body is changing dramatically, if you're in pain, if you're exhausted, if you're wasting away, that's not normal aging. That's disease. And the longer you wait to get help, the harder it becomes to turn things around. I've seen men come into my office who waited so long that the cancer had spread everywhere: bones, liver, lungs, and by then, all we could do was make them comfortable. Don't let that be you. Don't wait for the pain to become unbearable or the fatigue to become crippling. Act now, while you still have time and options. All right, we've talked about the 8 warning signs, and I know some of you are probably feeling anxious right now. Maybe you're recognizing some of these symptoms in yourself. Maybe you're thinking about a friend or family member who's been ignoring these signs. That's good. That anxiety, that concern, That's your survival instinct kicking in. Now let's channel that energy into action. Let's talk about what you can actually do today, right now, to protect yourself and catch prostate cancer early, when it's most treatable. First and most important, get screened. The two main tests for prostate cancer are the PSA blood test and the digital rectal exam, the DRE. I know, nobody likes the rectal exam. But here's the truth. It takes about 10 seconds, it's not painful, and it can literally save your life. The PSA test measures prostate-specific antigen in your blood. Elevated levels can indicate prostate cancer, but they can also indicate infection, inflammation, or benign enlargement. That's why you need both tests, plus a conversation with your doctor about your risk factors, your family history, and your symptoms. The American Cancer Society recommends that men start discussing screening at age 50 if they're at average risk, at age 45 if they're at high risk. That includes African American men and men with a family history of prostate cancer, and at age 40 if you have multiple family members who had prostate cancer at an early age. Don't wait until you have symptoms. By then, you've already lost precious time. Now let's talk about what you can control, your lifestyle. You can't change your genes or your age, but you can absolutely change what you eat, how you move, and how you take care of your body. Diet plays a massive role in prostate health. Studies show that men who eat a lot of red meat, processed foods, and dairy have higher rates of prostate cancer. On the flip side, men who eat plenty of vegetables, especially cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts, tomatoes, which are rich in lycopene, fatty fish like salmon and sardines, and healthy fats like olive oil and nuts, have lower rates. You don't have to become a vegetarian overnight, but start making small changes. Swap that steak for grilled salmon twice a week. Add a side of roasted broccoli. Snack on walnuts instead of chips. These little shifts add up over time. Exercise is another game changer. Regular physical activity reduces inflammation, improves circulation, helps maintain a healthy weight, and boosts your immune system. All of these things lower your cancer risk. You don't need to run marathons or lift heavy weights. Just move your body every day. Walk for 30 minutes. Do some stretching. Swim. Garden. Dance with your wife in the kitchen. Whatever gets you off the couch and gets your blood pumping. And here's a bonus. Exercise also improves erectile function, sleep quality, and mood. It's a win across the board. Now let's talk about supplements and natural support. I'm not saying supplements replace medical treatment, but there's solid evidence that certain nutrients can support prostate health. Lycopene, the antioxidant found in tomatoes, has been shown in studies to reduce prostate cancer risk. Zinc is essential for prostate function, and many older men are deficient. Vitamin D is crucial for immune function and has been linked to lower cancer rates. Saw palmetto is a popular herbal supplement for prostate health, though the research is mixed. Omega-3 fatty acids from fish oil reduce inflammation, and selenium, though you need to be careful with dosage, has shown some protective effects. Talk to your doctor before starting any supplements, especially if you're on other medications. But don't dismiss the power of good nutrition and targeted support. Here's your action checklist, and I want you to save this. Screenshot it, write it down, whatever you need to do. Number 1, schedule a prostate screening if you haven't had one in the past year, or if you've never had one and you're over 50. Number 2, pay attention to your body. Track your urinary habits, your sexual function, any pain or discomfort. Keep a simple journal if you need to. Number 3, clean up your diet. More vegetables, more fish, less red meat, less processed junk. Number 4, move your body every single day. Number 5, talk to your doctor about supplements that might support your prostate health. And number 6, this one's huge. Talk to the men in your life. Your sons, your brothers, your friends. Share this information. Break the silence. Prostate cancer thrives in secrecy and shame. When we talk openly, when we encourage each other to get checked, we save lives. Gentlemen, if you've made it this far, thank you for taking your health seriously. If this video helped you, if it opened your eyes or gave you the push you needed to take action, please hit that subscribe button right now. Smash the like button, drop a comment below telling me which sign resonated with you the most, and share this video with every man in your life who needs to hear this message. Your share could literally save a father, a brother, a friend. Don't keep this information to yourself. Prostate cancer is one of the most common cancers in men, but it's also one of the most treatable when caught early. The difference between a long, healthy life and a devastating diagnosis often comes down to one simple choice: paying attention and taking action. You've been given 8 warning signs today. You've been given the tools to protect yourself. Now it's up to you to use them. Get screened. Listen to your body. Make the changes. Have the conversations. Your life is worth it. Your family needs you. And remember, the truth isn't found in a pill or a quick fix. The truth is in knowledge, in prevention, in early detection, and in taking control of your health. Always remember, the truth goes beyond the pill.